Alright, so Dr. Varun's Clinic Pune. Uh, we have joined Ashi 1601. I have joined someone on YouTube, few more on YouTube. So this is fever questions answered, or session named as FQA, and it is day 4 of fever question answered, and I look forward to answer any questions that have come up for fevers in your clinics, in your practice, in your uh, whatever failures that you have encountered, or any success you have encountered where you feel that you need some more information. So I will go through some of the questions that we have already received on WhatsApp and also on Instagram story. Question 1 is how frequently to repeat medicine in fevers. So it all depends on what is the intensity. I have, I think, conveyed it earlier also, but since it is a repetition, I don't remember it if it was the same question. But it all depends on the intensity of the complaints and what are your parameters of prescription. Whether you are prescribing for the acute phase, what are, or whether you are prescribing for chronic phase, whether you are prescribing for uh, throat complaints or gastric complaints or catarrhal complaints, inflammatory complaints, all those scenarios exist. That will make your answer justifiable. Mostly it should be 200 or 1 m. If it is more of inflammatory fever, I go for 1 m potency with frequent repetition. If it is catarrhal fever, I go for 200 with frequent repetition, of course, 1 hourly or 2 hourly. And if it is a dull type of fever which is persisting since a long time, like it's been 5-7 days, go for a low potency and try to observe whether the patient will need any intercurrent medicine. It can be any nosode. And in such cases, nosodes will have to be prescribed in high potency. Prescribe the indicated medicine or the small medicine in a low potency, and try to juggle and see what symptoms are predominantly coming, and accordingly you will need to give the bigger medicine which is of a higher potency. So this needs to be more documented, which I have partly documented, and I'll be sharing in the fever workshop, which if you are joining, if you are a part of it, you will get to know how and when you can repeat. And that brings us to the next question, which says that when to change medicine in fevers. So as I told earlier, you will need to lay down some parameters to prescribe in fevers. And if you have those parameters, and if you wish to, you know whether the patient has been improving on those parameters 1, 2, 3, 4, 5, and then you will find that out of 5, only 2 parameters have been met and 3 of them have not been met. It takes, some issue for repetition, and you'll need to observe, and maybe you can change the medicine, go for a complementary medicine, or you should go for a retake and prescribe the medicine. So what should be done in COTS patient with frequent fever spikes? So first thing that you should know is that it's a deeper state, constitutional state. So Dr. Varun's Clinic Pune, I would like to answer, and that's a very nice question. So right, so with the first thing that you should know that it's a very deeper state, it's a constitutional state, and it will persist for a long time. So the first thing that you should do is to find out the indicated medicine for the constitutional state of the patient. You will have remissions like frequent fever spikes, which you tell. You will need to give smaller medicines or remedies that are acutes of the chronic medicine, number one, or else number two, you can think of smaller medicines which are indicated for short time for some symptoms. So on that note, you can understand that you will need to keep one medicine which is constant, and the frequent spikes that keep coming, that should require a smaller medicine which is of a shorter duration with frequent repetition for a short time, then goes comes back, like it can be squila, it can be sticta, it can be like some antin group, or it can be carbon group, like those remedies. So in such a case, try to ensure that this is done, and also you give the nosode every few days, like every month or every 15 days one dose with the constitutional medicine. That should probably help even more better. So that is what would best suffice to answer your question, Dr. Varun's clinic. And if there are any more questions from any other attendees, please feel free to share, or else we make a move. So we answered 3 questions, and out of which, can antipyretics be used to bring down the temperature? So sometimes you will need to take help from these antipyretics. There is no harm, because they are just bringing down the temperature. They are not going to cure the disease. So if the fever is above 101, which may happen rarely in few patients, nowadays pediatricians are also telling the patients to avoid the antipyretics and continue the dose of antibiotics or whatever are the medicines indicated in that phase. This is so as to bring down the infection, which will ultimately go and bring down the fever as well. So in this way, you can think of the indicated medicine doing the work. If the fever is above 101, which may rarely go, then you can take help of antipyretic. If the patient is educated enough and you can make him understand that the fever is there to kill the bacteria, virus, which you should explain, you can tell them to do cold sponging, and you can tell them to apply the lukewarm water sponging throughout the body in major areas. That is going to help bring down the temperature and give the medicine which you are giving, homeopathic medicine which you are giving at that descent of the fever. That will probably bring down the fever and also prevent the next recurrence of the fever which will come up. I have preferably given medicines in water, such doses, and with frequent repetition. It has helped immensely, and this is what you should also do if you are struggling to handle fever cases. So glad to see Dr. Jagruti 26, Kruba Shan, Ashish Desai, Ambika Jadhav, and few more on YouTube. So we answered few questions, like 4 to 5 questions so far on fevers. And if any other audience have any other questions related to fevers, you can feel free to ask today or else tomorrow, because the workshop on fevers begins on 15th August, and there is a lot of things which I'll be sharing from the last 16 years of my practice, where I failed a lot in fever cases, which everyone does, but then how I overcome the issues, what books I referred, what remedies I gave, how you should give the smaller medicines, how you should give the nosodes, when you should refer which repertory, what is the patient expression that you will convert to rubrics and find the appropriate repertory. All these things are going to be discussed in the fever workshop. Feel free to communicate any query that you have regarding the workshop, and we'll answer it. And you can join to learn everything about fevers and get the confidence to take your practice at the next level.